we have been raising our testing capacity to quite a large extent. And we announced earlier that we started out with about 2,900 tests per day, and now we are doing 8,000. In a few weeks' time, we might get to 20,000 a day, and our aim is 40,000 a day. For a population of the size of Singapore, 40,000 a day is probably ranks as one of the highest rate of testing in the world. But even with 40,000 a day, one has to decide how to allocate those tests. So when you say mass testing, even with 40,000 a day for a population the size of Singapore, it's not going to be effective if it is done in an uncoordinated way. So the tests that we have to be allocated to areas of priority. For example, we would want to have some tests allocated for regular community surveillance. So you pick up anyone with respiratory illness, you test them. That will take up some tests. Then you want to allocate some to the migrant workers. Even if the dorms are cleared, you want to test them on a regular basis, because we are concerned if, knowing the way the migrant workers, in terms of their work, particularly for the construction sector, the work environment and the fact that they are typically working in large groups, then you want to be very careful not to have large clusters forming again, right? So again, have to allocate some tests for the migrant workers to be tested on a regular basis. Next, you want to test the vulnerable sectors, like we've just talked about, nursing homes, the residents and the staff, healthcare workers with a community or high touch points with the community. Again, you want to allocate regular tests for this group of workers. We also want to test those on the front line of our COVID-19 operations who are caring for patients, working in dormitories, and we want to allocate some tests for them as well. Beyond that, there are a whole range of people who will be commuting daily to work. Today, as we've said, about 15% of the workforce are doing so. We call them the essential workforce. But in the coming weeks and beyond 1st of June, that 15% will grow, maybe to 20% initially, and certainly beyond 20% after the 1st of June. And so some tests will have to be allocated to them as well. So when we talk about mass testing, it's not just everyone raise your hand and then you can apply for a test. It shouldn't be like that. It has to be directed. Testing will be a national resource which we will apply in a strategic way to ensure that Singapore is safe from the virus.